Bismillahirrahmanirrahim. Hello everybody. So a 34-year-old woman gravid 2 para 1 comes to the labor and delivery unit at 38 week of gestation with contraction and spontaneous rupture of membrane with green fluid. The patient lives in a homeless shelter. Her only medical care during this pregnancy was an emergency room visit for spotting at 11 week of gestation. An ultrasound at that time confirmed her due date. Her first pregnancy 6 years ago was complicated by gestational diabetes mellitus and ended with a vaginal delivery of a 4 kg infant. The patient had an elevated 2-hour glucose tolerance test 6 weeks after the delivery but did not follow up afterwards. Today, blood pressure is 150 by 90 mm of Ag. Finger stick glucose is 179 milligram per deciliter. The fetal heart rate tracing show minimal variability but no deceleration. The patient delivered a 2.2 kg girl with ABGAR score of 6 and 9 at 1 and 5 minutes respectively. On physical examination, the infant appeared thin with loose skin and a large anterior fontanelle. No retraction or grunting is present. The placenta is meconium stand and the umbilical cord is thin. In addition to routine neonatal care, which of the following is the best next step in management of this patient? So as I told you that there is always a hint in the question. So first of all, where is the hint? So this first hint is that this patient is suffering from gestational diabetes mellitus. This is the first hint. The third hint is that this patient delivered a baby of 2.2 kg, which is a low birth weight. 2.2 kg. The normal birth weight is, as we already know, is 3.2 kg. So this patient delivered a 2.2 kg baby. And the third hint is on physical examination, the infant appeared thin with loose skin and large anterior fontanelle. This is the third hint. The fourth hint is that the placenta is meconium stand and the umbilical cord is thin. So this is the fourth hint. Let me revise again. I will also write here. The first one is gestational diabetes mellitus. This is the first hint. The second hint is low birth weight baby. Low birth weight baby of 2.2 kg. This is the second hint. The third hint is that the fetus appear thin. Fetus is thin with loose skin. And large anterior fontanelle. This is the third hint. And the fourth hint is that the placenta is meconium stand. Placenta is meconium stand and umbilical cord is thin. Umbilical cord is thin. This is the fourth hint. So based on these four hints, the diagnosis of this question is fetal growth restriction. As for fetal growth restriction, the risk factor is the mother. As a mother have gestational diabetes, the patient deliver low birth weight baby. The fetus is thin with loose skin. The placenta is meconium and umbilical cord is thin. These four hints goes toward the diagnosis of the fetal growth restriction. So in such cases, we will send the placenta for histopathological examination. So the choice C is the correct one. Why the choice C is the correct one? Because this fetus have fetal growth restriction, as normal fetus weight is 3.2 kg, but this fetus weight is 2.2 kg. As this mother have already risk factor of the gestational diabetes mellitus, and fetus have thin with loose skin, large anterior fontanelle, and the placenta is meconium stand and umbilical cord is thin. These all signs suggest fetal growth restriction. Therefore, the placenta should undergo histopathological examination to evaluate for the presence of infarction or infection. So the choice C is the correct one. Come to the incorrect one. Why the choice A is incorrect? Choice A, obtain karyotype of the infant. So If physical examination of the infant suggests a syndromic etiology, then a karyotypy may be indicated. Come to the choice B, where the choice B is incorrect. Perform cranial ultrasonography. So cranial ultrasound evaluate for intraventricular hemorrhage. Signs usually include a preterm baby with respiratory distress, that is tachypnea, grunting, and hypotension. This, as we know that this child doesn't have any symptom of hypotension, tachypnea, or grunting. Now come to the choice D. Choice D, start infant on antibiotic therapy. So antibiotic therapy is indicated for the treatment of neonatal sepsis. Choice E, start infant on surfactant therapy. So surfactant therapy is indicated for the treatment of meconium aspiration syndrome. With this with these, as I will once again revise the choice C, that why choice C is the correct one. Send placenta for histopathological examination. So as I highlighted here, that there are these, based on these four hints, this fetus is suffering from fetal growth restriction, as this mother have gestation diabetes mellitus. The fetus on delivery, the fetus weight is 2.2 kg, which when the fetus, if the fetus appear thin with loose skin and large interior fontanelle, and the placenta is meconium stan, and the umbilical cord is thin. So based on these four hints, the diagnosis of this question is fetal growth restriction. And on such cases of fetal growth restriction, we will send the placenta for histopathological examination to rule out any history of infection or infarction. So this one is the correct one.